and welcome to tonight's public hearing. This hearing will include Columbus City Council's Health and Human Services, Finance, and Workforce Development Committees. I'm Councilmember Priscilla Tyson, and I chair the committees. Before we begin, please be aware that this hearing is being recorded for rebroadcast on CTV, Columbus Government Television Channel 3. The rebroadcast schedule is available at www.columbus.gov. Tonight's hearing is one in a series of bi-weekly committee hearings that I hold in order to review legislation in the committees that I chair, which includes Health and Human Services, Finance, and Workforce Development. The goal of these hearings is to promote transparency and to provide an opportunity for city residents to learn and to speak on legislation that impacts their lives. There will be on occasion which a committee is not covered because legislation isn't always scheduled for each committee. The intent of each hearing is to review the legislation that will be on City Council's agenda within the following 2 weeks. Tonight, we will hear information on legislation in the Health and Human Services and Finance Committees. Legislation presented will be on Council's agenda February 1st or February the 8th. We have several speakers tonight on this agenda. We have Deputy City Treasurer Talia Brown, the Honorable Columbus City Auditor, Mr. Hugh Dorian. We have Deputy Director Dave Bush, representing Finance. And we have Health Commissioner Dr. Teresa Long from Columbus Public Health. I will begin with legislation from our Treasurer's Office by asking Deputy City Treasurer Talia Brown to present. The floor is yours.
Good afternoon, Councilmember Tyson. Thanks for having us. This ordinance, we don't have a number assigned yet. Actually, yesterday there was a meeting of the Columbus Depository Commission, and they approved the award of the e-payment services. So this is all something we're going to be getting into Legistar here in the next couple of days, so we don't have an ordinance number assigned yet. However, I'll give you a little background about this ordinance that's going to be coming to City Council for approval. The Treasurer's Office last March issued a request for proposal for citywide e-payments and services, and 139 vendors were contacted. And the proposals that were received, there were 3 of them, and they were reviewed by the Depository Commission, and they recommended a contract be awarded to First Data for the electronic payment services to be approved for a period of 10 years, which would begin March 2nd, 2016, and that would go through March 1st, 2026, and that would be subject, obviously, to annual appropriations and approval of contracts modifications by Columbus City Council. The Treasurer wishes to enter in a contract for the first year of the e-payment services for the period of March 2nd, 2016 through March 1st, 2017. This was a partnership that the Treasurer's Office established with working with technology, and they basically wanted to create a statement of work that is tailored for each department's needs for e-payment solutions. Previously, this income tax division had their own contract, and now they are joining us. We think it's always a good idea to have as many city departments collaborating on these sorts of things so that we don't have, we can have uniform services, and I think that saves taxpayer dollars and allows for convenience to our citizens. So we have on this contract, and I can't give you a total dollar amount yet because we're relying on the departments to let us know how much they need for their particular portion of the contract. But right now we have income tax, we have support services, we have health, we have building and zoning, and the division of water. And I'd also like to point out the reason why I think this is a good ordinance is that this will allow any type of payment solution to be adapted to the departments that need them, whether it's a very simple payment solution that they need or something larger that for like income tax, they have a lot of different needs for what kinds of e-payment services they require and other requirements and forms that may have to go along with it. So they do work with technology to establish a good platform through PayPoint, and they can then accomplish their individual needs that way. So I think it'll be a good ordinance. We are asking for emergency approval because the contract that we currently have ends on February 28th, so we don't want to have any interruption of services there for credit card e-payments. And that is all, and if you have any questions, I'd be happy to answer.
Thank you, Ms. Brown. And you mentioned some of the departments, but public utilities?
Yes,
Health?
that is one. Health, income tax, support services, building and zoning, and water utilities.
Will public safety be a part of this also?
We hope that in the future they will. There are certain departments that have their own solutions, and this is why we are establishing this contract, because now we can be open to allowing any division that wants to participate, and we have the opportunity to tailor it to their needs. So we have, a variety of services that are needed by departments, and we can't make them join, but we would love to have as many departments participate so that we can have uniform types of e-payment solutions all over the city.
Thank you. Well, we are excited that we're going to have e-payments because that's how people want to pay their bills today. And we want to make sure that we're meeting the needs of our residents as well as being efficient as a city. The only other question, I know you said you mentioned that we don't have a cost on it. And so when do you think we would have that?
This week, it should definitely, we just need to get some responses back from other divisions of exactly how much. And of course, as we know, the budget's coming up, so I think everyone's trying to get that figured out.
All right, so before we pass the legislation, we'll have the number, correct?
Yes, absolutely.
All right. All right, thank you very much. Thank you for presenting this evening. Our next presenter will be the Honorable Mr. Hugh Dorian.
Well, thank you, Councilwoman Tyson, and in particular, thank you for the attention you give to these matters. They are not matters of small amounts. This coming Monday night, we will present two ordinances to you asking your approval. The two ordinances are ordinance number 234-2016 and 235-2016. These ordinances, one will be in the amount of $410,345,000. The other will be in the amount of $48 million. Why so large? These numbers represent what we call not to exceed amounts. Their purpose will be to give us permission to refund some outstanding bonds that the city has for several years now. They do not permit us, and we do not seek to borrow additional monies or new monies, as we call them. This is to refund existing debt. We hope and think, seriously, believe that we will be able to reduce our debt service, meaning principal and interest, on these existing bonds. This is very similar to what we came to you this past December and accomplished a successful refunding. We reduced the city's debt service by about $22.2 million on that particular deal, and the present value of those savings was a little over $15 million. I'm not so sure we will do that well this time. It will all depend upon the market at the time. The sale of the bonds is scheduled for February 11th, and as usual, this is a collaborative effort between the City Auditor's Office and the Department of Finance and Management. And we thank all the other divisions who have participated also to some extent. So again, these numbers that we present to you, I would say to you, even though they amount to more than $400 million in the ordinances, if we were to do this deal today, we'd probably be more in the range of $300 million. I anticipate saving several millions of dollars. I always hesitate to quote any number. We won't know that until we actually do the deal. But I ask your support of these ordinances. We will report back to council the exact results of the deal, and that will be in the middle of February. As I said, the sale will take place February the 11th. One of the attributes, you might say, of these kinds of ordinances, there really is no risk in adopting the ordinance, because the bottom line is that if we cannot save money by implementing them, we simply won't do it. So I thank you for the attention you've given this. I ask you to support these two ordinances, and I should add, by the way, we're always used to dealing with 30-day ordinances or emergency ordinances. Well, there's another category which you're familiar with, and that's what we call Section 55B of the city charter, where an ordinance becomes effective immediately upon the mayor's signature. And that will allow us to go into the market at the most opportune time and proceed. So if you have any other questions, I'll be happy to do my best.
No, thank you, Mr. Dorian. I don't have any questions. I just really do appreciate you in terms of always identifying opportunities for us to be able to reduce our debt service. As you mentioned, we just had a phenomenal reduction at the end of last year, and that you're always watching the market to see when's the best time to do it. I also know that if the market isn't at the place where we feel that we're going to be able to reduce the debt service, you won't move forward. And so I just really do appreciate your attention to detail and how you are constantly looking at ways for us to be able to reduce our debt service. So I thank you, and I certainly am in support of this legislation, and I look forward to being in the meetings to listen to you and the Department of Finance and Management, as well as Development's always included, to make the presentation to the bonding agencies, and hopefully we'll get the same type of bonding credit rating that we've gotten before, and be ready to sell these bonds and save us some money. So I appreciate you being here this evening.
Thank you very much.
Thank you. Our next presenter will be the Deputy Director, Dave Bush, from the Department of Finance. Good evening.
Thank you for having us, Councilwoman Tyson. We appreciate the opportunity to present. For the two subject meetings, the 1st and the 8th of February, Finance anticipates 12 ordinances. Well, it would have been 14. Mr. Dorian capably covered 2 of them, far better than I. But the first 3 ordinances, Ordinance 2887, 2015, 2888, 2015, and 2889, 2015, are the ordinances that the prior administration submitted to reflect its proposed 2016 operating budget. As you well know, that deliberations and final decisions on those specific ordinances are with council, and I would anticipate some action on their part over the next several weeks. So there's really no different story than we've previously presented to you. The next ordinance is Ordinance 3094-2015, and that I am ably assisted by Sean Fouts here, our procurement manager, and he's going to walk through what some of the more salient points to some of the ongoing 329 revisions have been. Certainly, Council has been a partner to a variety of improvements on the 329, or the city's procurement code, which covers construction, goods and services, professional services, and the like. So without further ado, Sean Fouts.
Thank you. Good evening, Councilmember Tyson.
Good evening, Sean.
Thank you for the invitation. What I'm here to speak about is Ordinance 3094-2015. The first thing I would like to point out is there were 5 changes in the ordinance as drafted. After some discussions with Director Lombardi, we've decided to only ask for those things we need immediately and take the other, so those are 2 items I'll speak of tonight, and add the other 3 to hopefully a future ordinance where we hopefully present council and work with council for a more comprehensive change of Chapter 329. So the 2 items that we believe we need that would be helpful to the city to change immediately. The first is concerning bid openings. As you may know, we recently implemented a brand new vendor portal that allows us to, with the leadership of Mr. Dorian in the auditor's office, that allows us to receive all formal bids online. So part of why we need a change is the current code was written in the 1980s when nothing like that existed, and the current code requires you to have a public bid opening physically. So I've drafted this ordinance to allow that to still be an option, but to add the option that you don't need a public bid opening if you open the bids online. So we've added safeguards that we will make the same information that we make available at a public bid open available immediately. With electronic communication, it will actually be available more quickly than a public bid opening because it's literally just a matter of pushing a button, and anyone who has access to our vendor portal can see all of the bids received. So that's the first change. The second change is we wanted to change the informal bidding threshold from $1,000 to $5,000. So currently, if a division wants to buy any good that's above $1,000, they must send that to the purchasing office, and we must receive quotes with few exceptions. I'm asking to increase that dollar amount to $5,000. Many reasons I think this will be helpful to city agencies. One thing, the same system that we're implementing that allows us to do online bidding, it also makes many changes in our accounting structure, many changes for the better, one of which is giving us better control as a finance and management department over making sure that people are buying the items they're supposed to be buying that are under contract for the correct price. The negative end of that, as we make it a little harder for them to get some of the items they need the wrong way, we need to give them the opportunity to do it the right way. So by changing this $1,000 to $5,000, we believe that those city workers who are working on an item and need a part for $1,500 as an example to fix that broken item they're working on, and they know where it's available, instead of making them wait 5 or 6 days to do a bid where they know that that's the only place they can get it, we give them the opportunity to work with their fiscal officer to get a purchase order, to go with a local vendor that is contract compliant. We also hope that by making this change, we can increase our minority and female minority spend. Currently, in purchase orders between the amounts of $1,000 and $5,000, our spend is very low, and our participation rate on those bids is very low. So we hope we can create an opportunity for our city agencies to get greater participation with local minority and female vendors. Also, we hope that this will free staff to spend time on more higher dollar amounts. Although these are small dollar amount contracts and bids, when you do them right. And sometimes you can spend a lot of time on a $3,000 bid where there are you only have so much staff, and there are other projects that are larger dollar amounts that don't get the amount of time that they could receive. So these are the two changes we're asking for, that we will be asking for in ordinance 3094. So thank you.
Thank you, Sean, first of all, for the work that you have been doing in order to change the purchasing code. I know you spent a lot of time on it, so I appreciate the work that you've done. A couple things. So one, we're going to obviously make an amendment to the ordinance, because the ordinance that's in front of me has the 5 areas that we had talked about. And so now we're going to only look at the 2. Is that correct?
That's correct.
Okay. And so look forward to having further conversations on the other 3, because we talked about those. So again, just kind of to recap this ordinance, the changes that we're going to make to the code for electronic bid openings will make it so that all the bids open at the same time, and then people, is that right?
Correct.
Correct? And then people will be able to see what the bids were pretty quickly.
Right.
Okay, so that's great. And also, it will, with this new system, it saves staff time. Would that be correct?
That is correct. That is correct.
So, right, so I think that between this change and then the change that you mentioned before, I think key is that we did commit to our residents that we would make sure that we would not only save dollars, which you've been doing, but we'd also be more efficient. And so this helps us to be efficient and to responding to the needs of the companies that are submitting these electronic bids. And then the other, in terms of the procurement, first and foremost, I think it's important that that the city agencies that need those parts, that they're able to get them pretty quickly. And we want, and again, it helps us be more efficient.
Right.
It allows, so we don't have people waiting, you said, like 4 or 5 days to be able to get the parts, to be able to fix the vehicles, to be able to do the services in our community. So our community continues to be better served based upon that. Additionally, we will always want to, and we know that smaller minority businesses are so important to the growth of our city, and they hire a lot of individuals, and we want to, and that's how we get our income tax. And so we want to be able to support those smaller minority businesses to be able to do business with the city and help them grow as well as help the city grow. And and again, the city staff, again, is more efficient because now you're spending time on some of the other and larger goods and purchases that we need to make. So I appreciate the work that you've done on it. I'm in support of these 2 changes and look forward to the further discussion on the other changes.
Thank you very much.
Thank you. Deputy Director?
Sure. Thank you, Sean. You'll obviously, again, see that ordinance within a few weeks, short time. The next ordinance we have on our agenda is Ordinance 0144-2016, somewhat ministerial in nature. It's a changing the name of a vendor to more formally cite a reestablishment of their name. It's Gall's RT, the second LLC to a more.
The name again of that one, 01 what?
The ordinance number is 0144-2016.
Okay, thank you.
And Gall's is our uniform provider for police and fire. They have a new federal ID. It's the same company. They just have a new name and a new federal ID. So since our contract documents refer to their old name, we need an ordinance to correct that. Ordinance 090-2016 is an ordinance that we do annually. The dollar amount is $14,737,645.15. But essentially, the ordinance does 2 things. Number one, it provides the backstop that the city agreed to the Convention Facilities Authority when it leased city property for the construction of the modern convention facility as we know it today. Between the city and the county, both bodies have agreed to backstop in the event there was an inability for them to pay the debt service. Since 1990, that has never happened. This is an annual ordinance. We come to you every January to establish the monies. 12/31, they fall off, and we started anew in January of the next year. The second part of the ordinance is about half of the total. And again, this is from the special income tax, and this is to the River South Authority. You'll remember the former Lazarus Complex and the like. The city's lease arrangement with River South is to pay the debt service on the obligation until complete. The debt service in the coming years, $7,040,862.50. So again, large dollar amounts between the 2 ordinances, but routine, if you will.
Yes, thank you.
Moving along, Ordinance 0219-2016. This is an option to establish 2 UTC contracts, universal term contracts. This is some of the other work of the purchasing section of finance. In this instance, it's with sewer and water for pipe for the divisions that the divisions consume. The 2 suppliers, Discount Drainage Supplies and Ferguson Waterworks, were both deemed lowest in one category or another of the entire bid. The estimated annual expenditure is $35,000 per vendor per year. So in aggregate, approximately $70,000. We established the terms and conditions, and and this is a 4-year contract, and so it allows the division to establish purchase orders from time to time to buy the product to provide the services. Ordinance 0236-2016 is an ordinance that benefits the Municipal Court Clerk Computer Fund. Essentially, this is cleanup in nature as well. With the abolishment last year of the sinking fund, the instrument that would pay debt service on city bonds and notes. This particular bond obligation is one that the court clerk uses for computer acquisition, computer services. It isn't changing the dollar amount or increasing it. It's simply paying for it differently than the original setup through the sinking fund had established.
Thank you.
Ordinance 0258, 2016 is an ordinance on behalf of the Division of Fleet Management. As you know, we have well over 6,000 vehicle assets in the city with many, many thousands of pieces and parts. We have, with the assistance of purchasing, established a variety of UTCs, universal term contracts. This allows the division to set up purchase orders for those items, things like oil, tires, auto parts, and auto services. There is a $400,000 component to this total dollar amount of a little over $3 million, and it's a blessing we receive, hopefully, from council every year, where some fraction of the total is coming to you in the form of a request to waive competitive bidding. To the conversation you were just having with Sean Faust a few moments ago. If we have a vehicle that's laid in for whatever reason, and there's a piece or a part that we're not able to have under a current contract, but nonetheless we have to provide the piece or part to keep the vehicle going, whether it's a cruiser or a fire apparatus or refuse. So we do, again, come from time to time, and I would just reiterate the fact that of the total, 400,000 of that total of 3 million plus is the bid waiver, not the entire amount.
All right, so this legislation, so the Fleet Management Division operating budget contains $5.6 million for the purchase of automotive parts, services, supplies, and services. And so this legislation is authorizing expenditure of $3,080,000.
A part of the total. We'll come back to you later as our needs get more defined if we need to, but that total supply budget is for other items as well, which will be submitted under separate legislation.
And, okay, and so during the 2016, the Fleet Management Division's budget to spend $4.3 million for parts and the $1.3 million for services. Is that right?
Correct.
For the total of the $5.6 million. Okay.
And I know you've heard the story frequently from our fleet friends, but the city has done a very good job of greatly reducing vendor services. In other words, third-party purveyors of services for the fleet division. And those numbers, they haven't dropped as precipitously as they had a few years ago, but we're holding. And that's a good thing. It means that we have city employees that are capable and qualified to provide those services for the city divisions at what we feel is a better price than they would otherwise get them in the market.
Well, certainly I have the utmost respect for the Fleet Management Division and the work that they do in order to keep all of our vehicles moving in the proper conditions so that we, again, can be able to respond to the needs of our community. So I appreciate the work that Kelly Regan and his team is doing there. And so certainly I'm in support of this legislation.
Thank you. They work hard. The last ordinance is also the second to last. Well, I said the last. I actually have three more. I apologize. Ordinance 0260, 2016 is another ordinance for fleet management. This is from a contract that was competitively bid with Crown Welding and Fabricating. Crown might be asked to come in and weld a frame that's broken. It might be a snow blade. It would be certain services that would be beyond the capability of the division. And in some instances, and I'm thinking of fire, there are some certifications that go with the welding and the fabrication that have to be met in order for the division to be continue its ongoing certification that fire and covets, from its its public sector accreditation process and the like. This was a competitively bid contract. The ordinance provides for extensions. This is monies, $70,000, or excuse me, $100,000 for year two of a 4-year contract period.
Thank you. And this ordinance and the previous ordinance and many of these ordinances are contingent upon our budget passing
That is
on
correct.
February the 8th. So I just want to make sure we're stating that. Thank you.
Yeah, and the reason we're bringing to you them the way we are is that they're literally the bread and butter of those divisions. So the hope is that the evening or very close to the evening that the budget is adopted, that they could be considered by council as well to keep that supply chain in place.
Absolutely. Thank you.
Ordinance 0274-2016 is the authorized strength ordinance. The authorized strength is another budgetary tool. It establishes the number of bodies that a department or division can have. And that's an additional budgetary control, as is the budget itself, how much dollars that division is being given, or even, the management compensation plan and some of the other ordinance that establish compensation and the like. This particular authorized strength reflects the 2016 budget as was proposed. So it would go hand in hand with the adoption of the budget.
And so that's just considered full-time?
Full and part-time.
Okay. All
And
right.
all funds. And the department comes to council from time to time throughout the year, occasionally making adjustments for whatever the merited reasons are at the time. But typically, it comes in annually in January when the budget's being presented.
And I understand why, because as you just mentioned, that whatever the authorized strength is, there's certainly other ramifications for the authorized strength. And so I appreciate that we always have legislation on it, because it does affect, the personnel costs. It affects everything that we're doing. So thank you for bringing this. Thank you.
And the last one, and this time I'm not lying, is an ordinance, again, a renewal. This is on behalf of facilities management with K&M Cleaning. K&M Cleaning provides third-party custodial services to the Fire Academy or the Practical Skills Building down on South Parsons. The way the contract was bid initially, it provided for up to 4 renewals. This is the third of the 4 renewals. There would be one more after this. This is the budgeted amount, and it would fund the contract through February 28 of 2017. We have a similar cleaning contract that we would be bringing to you for the Police Academy and for the health facility at 240 Parsons.
All right. Thank you very much. I'm in support of it.
And with that, that is this is Finance and Management's anticipated legislation on the first 2 meetings in February.
Thank you, Deputy Director, and thank you, Sean, for being here tonight.
Thank you.
Our next speaker will be Dr. Teresa Long. Good evening, Dr. Long.
Good evening, Council Chair Tyson and colleagues. So tonight we have 8 items, 8 ordinances to bring before the committee's consideration. All of these would appear on the February 8th, 2016 council agenda. And of course, this would be dependent upon the council passing the budget for 2016 that evening as well. Would you like me to begin?
Yes, please.
Great. So the first item is connected to the Columbus Neighborhood Health Centers, and actually we now know them as Primary One Health, but they are doing business as Primary One Health. Our still contract is with the Columbus Neighborhood Health Centers, Inc., and it's ordinance number 0184-2016. And this is our annual agreement with them and contract for the provision of primary health care and dental services to needy residents in the area. This amount, or this ordinance, would authorize funding for all of the centers for the period January 1st, 2016 through December 31st, 2016, and would allow us again to enter into the contract for $4,799,110 with the health centers through the Health Special Revenue Fund. This ordinance does waive competitive bidding.
Dr. Long, I know why we're waiving competitive bidding, but for the viewing and listening audience, do you want to share why we waive competitive bidding for this particular contract?
So this is both a long-term relationship, and it really is a mutually beneficial relationship between the City of Columbus and the Primary One Centers, or Columbus Neighborhood Health Centers. They have been a vendor that actually we helped create as an organization. They serve as the largest federally qualified health center in this community. They leverage funds and resources that we provide with federal funds. And indeed, we actually have multiple other relationships with them. They are a high-quality primary care provider located in now actually 10 sites, 10 neighborhood locations throughout Franklin County, and actually one additional one down in Pickaway County. But indeed, this has been a long-term relationship. We continue to review the relationship and contract. We likely will be doing that again this year. But again, this has been a mutually beneficial relationship for the city, and again, with Primary One Health. They serve approximately 40,000 Columbus and area residents for primary care, dental, ophthalmology, and other services.
Thank you, Dr. Long. And one comment I'll make, I know sometimes people may wonder why all the individuals that we're serving at the Primary One, why aren't they using the Affordable Care Act? And I just know that they're seeing patients that do not even qualify for the Affordable Care Act. So we have a special relationship with them, and I know that they certainly are working closely with our maternal health and our mothers that are who've had children or getting ready to have children, and to work with them to help us with our number one issues we're facing in our city around infant mortality. So just appreciate their partnership.
Absolutely. Thank you.
Thank you.
So the next item is ordinance number 0182, 2016, and this is for reference laboratory services. As you are well aware, Columbus Public Health provides laboratory testing of medical specimens for a variety of different programs within our Columbus Public Health organization. LabCorp of America has been providing laboratory reference services, that is, services that we do not provide that are necessary for some of our program areas. So this contract for $22,000 would allow us to contract with LabCorp for February 1st, 2016 through January 31st, 2017. And again, the funds would come from both our Health Special Revenue Fund and the Health Department Grants Fund. Again, this, as we're talking about competitive bidding, this would also waive the provision of competitive bidding because the vendor has a special relationship with the software system that we use called NextGen. They have customized our electronic health record to the laboratory services and the laboratory test results. So this customization took a lot of energy, time, and resource to create. So it would not be in the interest of the city financially nor otherwise to actually change the relationship with this vendor at this point in time.
Thank you, Dr. Long.
The next item for your consideration is a contract for supportive services. You heard Director Bush speak about security services. This is a contract with Ohio Support Services for security services at 240 Parsons Avenue, our main location. It is ordinance number 2015. This item actually would allow us to contract for security officer services at 240 Parsons. This actually is a contract that is for $360,000 with the Ohio Support Services Corporation. We actually would enter into that contract from March 2016 to February 28th, 2017. This actually was competitively bid. This is actually the second year of this competitively bid contract. We have been very satisfied with their services. There were 7 companies that did respond to that RFP, and then in consultation, the evaluation committee unanimously recommended awarding the contract to this organization, Ohio Support Services.
Thank you.
The next item is one you may be familiar with. It's one that many of these we bring forward every year. This is with an organization that allows us to purchase a special blood test for tuberculosis. It's called QuantiFERON, and we use it, again, in our TB program. It's ordinance number 0231, 2016. And this allows and authorizes the Director of the Finance and Management Department to establish a purchase order for us to purchase this QuantiFERON blood assay for our Ben Franklin Tuberculosis Control Program, not to exceed $25,000. This is the gold standard. It is actually the only test, the only in vitro test for Mycobacterium tuberculosis for the infection that is approved by the U.S. Food and Drug Administration. And so it is highly recommended. It is the only recommended test by the Centers for Disease Control and Prevention. So Qiagen is the sole manufacturer and distributor, so we would like to go ahead and set up that purchase order, so then we can draw that down as we need to by necessity for different persons to provide the testing for.
Thank you.
The next item, which is Ordinance 0203, is a consulting contract for the Ryan White Part A Process Improvement Project. And as we have spoken before, this ordinance, which is 0203, 2016, we are fully committed to trying to continue to improve the quality of our services and work with our community partners. The Ryan White Project, as you know, provides support services for persons with HIV infection and their families, but primarily the persons with HIV infection. We were awarded funding from the Ohio Development Services Agency to undertake this process improvement project using the lean methodology. And so our HIV system of care, which is a group of community partners, has evolved and become more complex. We would like to work with this group to improve the process of linking new consumers with HIV to medical case management. So indeed, we would enter into a contract with the supplier. The supplier's name is actually Supplier Six Sigma. It's a Lean Ohio approved consultant, and if you're not familiar, Lean Ohio is the state of Ohio's process improvement, quality improvement project connected to the Baldrige effort across the country. So again, this approved consultant would manage, facilitate, and coordinate the elements of this quality improvement project. And again, we would run it from January 1st, 2016 through August 30th, 2016 for an amount not to exceed $43,000.
Thank you. And so this particular system is going to be able to help us make, the public health department, public health, to be able to ensure or understand the case management for all individuals or the number of individuals that have HIV and AIDS, to link them with the appropriate services?
Correct. It actually is working with our partners to see and to ensure that we are as efficient and effective as we can be. We identify persons with HIV infection from a variety of testing areas. Obviously, one of them is right at our main health department location, but actually from anywhere in the community. And then it is our Ryan White care coordinators that jump in and try and connect them as rapidly as possible with the needed services. And so we have a variety of partners in that effort, and so we want to work with them to see that we are not misstepping, any of us, and that we are getting persons linked to care as rapidly as possible.
I'm glad that we have these funds, and because we have, as you know, a number of individuals in our community that have HIV and AIDS, and we want them to have the proper services.
That's exactly right.
So thank you.
Thank you. And again, we look forward to working with all of our partners and then with the vendor to work on this project. The next is an ongoing relationship for TB pharmacy or tuberculosis pharmacy services. It's Ordinance 0186, 2016. As you know, and others do know, that we operate the Ben Franklin Tuberculosis Clinic on behalf of the county commissioners for the entire county. We actually do need pharmacy services to be sure that we're in compliance with the requirements of the State Pharmacy Board. And so again, these services really are very clear, as stated by the Pharmacy Board, that have to do with the oversight of our storage processes and locations, the inventory, the ordering of medications. It also has to do with patient chart review, patient education, staff training, and assisting our physicians as they are actually both making the diagnosis but ordering the specific care for each individual patient. So this is a proposal. Again, it was a competitively bid proposal. It's the third year of a 3-year contract with pharmacy people, and the amount, again, for this year-long period, February 1st, 2016 to January 31st, 2017, is for $24,772.80, and we will be paying an hourly rate of $59.55 per hour.
Thank you.
So the next item, again, all of this is pending the approval of the budget, but again, funds coming, in this case, from Franklin County. We would take some of those funds and turn around and contract an ordinance number 0187, 2016, for physician services for that TB program with the Ohio State University Internal Medicine LLC for physician services. This is actually for medical direction services for an infectious disease expert in Mycobacterium tuberculosis to provide oversight, guidance, and actually clinical support for the TB program services, patient services for the period March 1st, 2016 through February 28th, 2017 for an amount not to exceed $31,000.
Thank you.
And then the final 8 of 8 is a revenue contract. We always love revenue contracts. We give a lot of money away, but we always like to take it in. This is an interesting revenue contract. It's a new revenue contract for us. It's with Franklin County Children's Services, and this is ordinance number 0207. This is actually connected to the work related to infant mortality in our community. And what this will allow us to do is to support a neighborhood. As you know, we have been working very hard with neighborhoods. This will allow us and actually our whole team. I know you're familiar with the work that is going on through Celebrate One. This will allow funds to be placed at a neighborhood level. In this case, FCCS is stepping up and saying they are willing to fund the community work in the Linden community as charged by the Greater Columbus Infant Mortality Task Force. They will be placing through us, obviously we will be directing this for funds at the St. Stephen's Community House. This allows us, as you know, there's also funds proposed in the budget, would allow us to take on 3 other neighborhoods, so that will be great. That will allow us 4 neighborhoods to be working in this area directly, having someone located in a community organization being the lead person for the rest of us in the city and the rest of us as partners to be able to work with on infant mortality related issues. So again, we hope that this will be an ongoing relationship with Franklin County Children's Services. This is for $100,000, and it would be for a contract period of February 1st, 2016 through, again, December 31st, 2016.
Dr. Long, can you share the intervention work, because it says that addresses the social determinants of health. So what does that consist of?
So as you are familiar with, we actually have had a pilot neighborhood that has been working on these social determinants of health on the further south part of Columbus. And so the social determinants of health may indeed have to do with issues related to housing, issues related to access to food, both food security issues or fresh and available food. They may have to do with access to health services or expanding health services or connecting to health services, whether that be what's available right in a neighborhood or what kinds of services a neighborhood group would like to see more of. So again, this is a broad-based approach. Housing services have come up as an area of interest as well. So indeed, what this will allow, and as you know, we've had Erica Clark-Jones working on our Columbus Public Health team, along with the development department's colleague and many of our residents starting to work in neighborhoods, saying what is it that's of particular concern, particular interest in a neighborhood that would relate to improving the well-being of residents. And indeed, these funds will allow that work to continue, but actually place a full full-time person in, and again, in this case, the likely agency organization is actually St. Stephen's Community House, Settlement House, and again, they will have a full-time person placed there. They will be hiring the person who will then work with both Columbus Public Health, our development department, all of our other partners that will have a better birth outcome effort to, again, see that all of these initiatives and the priority initiatives of the neighborhood are undertaken.
Thank you, Dr. Long. And this work is really important work. I know it on the South Side. So a lot has changed in the South Side just due to understanding what the needs are in that community. And so we're hopeful that the Linden community, we know that there's a number of needs in the Linden community. And as we have these individuals working especially now at St. Stephen's, that certainly want to be able to get updates as to what they're hearing and what the needs are in that community. Because as a council working with the administration, we certainly want to be able to help meet those needs. I know that this last year, in terms of just the issue around access to food in the food pantries, by us having the mobile access program that we funded through 211, that we know that in that community, based upon using their cell phones to be able to make appointments within that community, that more people have now utilized the food pantries that were there. They were going outside their community because not knowing the ones that were immediate within their area. And so we do have the numbers on that to be able to share. It's pretty astonishing how the individuals in the Linden area are now utilizing the food pantries that are right there in their neighborhood. So I think that as a body, we certainly want to, as I can speak for myself and my committees, we want to work with the administration to be able to help to meet those needs within that community so that we can improve the quality of life for those residents. So
Well,
excited about getting this money and look forward to improvements that are certainly needed within the Linden area.
Absolutely. And Councilmember Tyson, I would just say that this kind of work connects a lot of your commitments around housing, around food availability and security, around access to quality health services. So all of this is about improving the well-being and in this case, the social infrastructure in a neighborhood. So indeed, it's rolling up a lot of both your interests and I think what will actually help us to significantly make a difference both in this neighborhood and hopefully in the other neighborhoods of high need.
Thank you, Dr. Long. And so with that, I hope that this evening's hearing has provided insight into the programs and community initiatives from Columbus Public Health, as well as finance-related legislation that is necessary to support our ongoing city operations. As residents, these hearings are an opportunity for you to learn and become engaged in issues that are presented. I also want to mention that we will have a public comment hearing on the 2016 budget on Thursday, January the 28th at 5 p.m. And again, I would encourage residents to come down and share their insight on the 2016 proposed budget. Before I conclude, tonight's hearing, I want to thank Deputy City Treasurer Talia Brown, the Columbus City Auditor, Mr. Hugh Dorian, Deputy Finance Director Dave Bush. I also want to thank Sean for being here and making his presentation, the work that he's doing around purchasing. And last but not least, our Health Commissioner, Dr. Teresa Long from Columbus Public Health. I also always want to thank my council members and their staffs who serve our community with pride each and every day and wanting to address their needs and concerns. I also want to thank the City Council's Legislative Research Office, especially Michael Kessler, who's just joined our legislative research team. He is the director, I've got these new titles, but he's the lead, the manager of the Legislative Research Office. I see our new chief of staff in the office, in the council chambers tonight, Mr. Ed Roberts. Thank you for being here. And so I want to thank Michael, and also I want to thank Matt, who was here, who is the Legislative Research administrator for finance, and also Andrew Dyer, who wasn't here this evening, who staffs Health and Human Services. So I want to thank he and Matt for their work. And also my staff, Nicole Harper and James Lewis, who work hard to be able to respond to the needs of our community. And then lastly, the hardworking team of CTV, because we certainly couldn't have these hearings without CTV making these hearings possible. And finally, the residents of the city of Columbus, who make our city the best place to live, work, to raise a family. And so thank you, and the hearing is adjourned. Thank you.